In the realm of infectious diseases, the human Metapneumovirus, or HMPV, often lurks in the shadows, overshadowed by its more infamous cousins like the flu and RSV. Discovered in 2001, HMPV is a relatively new entrant to the scientific stage, yet its impact is far from insignificant. This stealthy virus belongs to the Paramyxoviridae family, a group known for causing a range of respiratory illnesses, particularly in young children. Despite its recent discovery, HMPV is incredibly common, with most people encountering it in their lifetime, often during childhood. While many experience mild, cold-like symptoms, HMPV can pose serious health risks, especially for vulnerable populations like infants, the elderly, and those with weakened immune systems. Understanding HMPV, its modes of transmission, and the potential consequences of infection is crucial for implementing effective preventive measures. By shedding light on this often overlooked virus, we can empower individuals to make informed decisions about their health and well-being. Human Metapneumovirus, like many respiratory viruses, spreads effortlessly from person to person through seemingly innocuous interactions. The virus takes advantage of our everyday activities, hitching rides on tiny droplets expelled into the air when an infected person coughs or sneezes. These droplets, laden with viral particles, can travel up to 6 feet, potentially infecting anyone within their trajectory. Direct contact with an infected person, such as through a handshake or a hug, can also facilitate the virus's journey to a new host. The virus can linger on surfaces like doorknobs, toys, and countertops for hours, waiting for an unsuspecting hand to transfer it to the nose or mouth. Children, often less vigilant about hygiene practices, can become unwitting vectors, carrying the virus from daycare or school to their families. Understanding how HMPV spreads is paramount to implementing effective preventive measures. The transmission of HMPV relies on a trifecta of close encounters: direct contact, respiratory droplets, and contaminated surfaces. Direct contact, such as touching or shaking hands with an infected person, provides a direct pathway for the virus to transfer from one individual to another. Respiratory droplets expelled during coughs or sneezes are another major culprit in HMPV transmission. These microscopic droplets laden with viral particles can travel through the air, potentially reaching the noses and mouths of susceptible individuals nearby. Contaminated surfaces serve as silent accomplices in HMPV's spread. The virus can survive for hours on frequently touched objects like doorknobs, light switches, toys, and even phones. Touching a contaminated surface and then touching one's eyes, nose, or mouth provides an easy entry point for the virus. By minimizing close contact with sick individuals, practicing good respiratory etiquette, and maintaining meticulous hand hygiene, we can significantly reduce the risk of HMPV infection. Section 4. From Sniffles to Struggle. Recognizing the symptoms of HMPV. Human Metapneumovirus, or HMPV, is often associated with a spectrum of respiratory symptoms that can mimic those of the common cold. In many cases, particularly in healthy adults, HMPV infection may manifest as a mild illness, characterized by a runny nose, cough, sore throat, and congestion. Some individuals may experience headaches, low-grade fever, and fatigue, further blurring the lines between HMPV and other common respiratory viruses. However, HMPV infection can take a more serious turn, particularly in young children, older adults, and individuals with compromised immune systems. Infants with their developing immune systems are particularly vulnerable to severe HMPV infection, which can lead to bronchiolitis or pneumonia. These conditions can cause significant breathing difficulties, requiring hospitalization and, in some cases, intensive care. Older adults, especially those with underlying health conditions, are also at increased risk of developing serious complications from HMPV. Recognizing the signs and symptoms of HMPV is crucial for seeking timely medical attention and preventing the progression to more serious illness. Section 5. Shielding ourselves, effective strategies to prevent HMPV infection. While there is no vaccine currently available to prevent HMPV infection, a range of effective strategies can significantly reduce the risk of contracting and spreading this common respiratory virus. Good hygiene practices, particularly meticulous hand washing, remain the first line of defense against HMPV. Washing hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing, before eating and after using the restroom, can effectively remove viral particles from the skin. When soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can serve as a convenient alternative. Avoiding close contact with sick individuals is another crucial preventive measure. Covering coughs and sneezes with a tissue or the crook of the elbow can also help prevent the spread of respiratory droplets. Regularly cleaning and disinfecting frequently touched surfaces can further reduce the risk of HMPV transmission. Section 6. Weathering the storm treatment and management of HMPV. Currently, there is no specific antiviral medication available to target and eliminate HMPV infection. Treatment primarily focuses on alleviating symptoms and supporting the body's natural defenses as it fights off the virus. Rest, fluids, and over-the-counter medications can provide relief from common HMPV symptoms like fever, congestion, and cough. Over-the-counter pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help manage fever and discomfort. Decongestants, available in oral or nasal spray forms, can help relieve nasal congestion and improve breathing. Humidifiers or cool mist vaporizers can add moisture to the air, soothing irritated airways and easing congestion. In severe cases of HMPV infection, particularly in infants, older adults, or those with weakened immune systems, hospitalization may be necessary. Hospitalized patients may receive oxygen therapy to support breathing, as well as intravenous fluids to prevent dehydration. Section 7. Staying ahead of the curve. The importance of HMPV awareness. While HMPV might not be as widely recognized as other respiratory viruses like the flu or RSV, its ability to cause widespread illness, particularly in vulnerable populations, underscores the importance of raising awareness about this often overlooked threat. Understanding the modes of transmission, recognizing the symptoms, and implementing effective preventive measures are crucial steps in mitigating the impact of HMPV on individuals and communities. Healthcare providers play a vital role in educating patients about HMPV, emphasizing the importance of hand hygiene and respiratory etiquette. Public health campaigns can further amplify these messages, reaching a wider audience and promoting a proactive approach to respiratory health. By prioritizing respiratory health, we not only protect ourselves but also contribute to the well-being of our communities, particularly the most vulnerable among us.